So now namaste and hello. My name is Bonnie Van Sandler, and I'm a body worker, a yoga therapist, a trauma therapist, Reiki master, a few other things. And I've been working with people with scar tissue for many years. And so I thought I would present this to you. Do know that I'm not a doctor, and you should always consult your doctor or your physical therapist on anything that I say, because that's my disclaimer alert. So make sure you do that. For the purpose of this video, I am educating scar tissue, but I'm also another shoulder surgery warrior. I had surgery on June 30th. I had major reconstructive surgery of my right shoulder, and I was in a brace for 6 weeks, and a lot of pain and a lot of suffering. But we all know about that too. Scar tissue. So here's a little picture of shoulder surgery. Look at the way that the instruments are placed in. We call those keyhole incisions or laparoscopic. In my maybe not so humble opinion, these are very difficult to work with the scar tissue. I have both an open incision and 4 or 5, I lost track, in keyhole incisions, as well as many anchors. Scar tissue needs to be remodeled. You can't really break it up. That's a mythological thing. It can be scattered or relayered, but it can't really be broken up. And I believe that this remodeling needs to be done by us as well as our physical therapist. It needs to be mentioned. It needs to be talked about. So we do need some scar tissue. It's essential. If we didn't have it, we would all have gaping wounds. So it's a natural response for humans to create scar tissue. It's more the internal scar tissue that I'm concerned with than the appearance of your scar. It probably looks fine. If it doesn't, that's another topic. But there are layers and layers and layers of internal scarring. This happens from any physical injury, a burn, acne. But in our case, we're concerned about the scar tissue left from surgery. This is the natural body's way of healing. However, the body can overheal and produce an excess of scar tissue, an excess amount of connective tissue. And this is when we get into a problem. But without explaining what fascia is, this wouldn't be a good conversation. So fascia, skin is the largest organ in the body. Wherever we have it, we're covered with it. It's made up of a lot of things, collagen, water, and it's everywhere. We have 7 layers. We have the outer layer, which we all know about, called the dermis, and then there are 7 layers. It holds our body together. This connective tissue is from head to toe. You can see the connective tissue. It wraps around the organs. It keeps the bones together. It keeps everything together. So we do need it. It also holds an emotional intelligence, which I think is really important. So there are issues in tissues. That's a whole nother conversation, but the fascia never forgets. Anyway, so scar tissue is made up of layer upon layer of this fascia, and we all have it. When we have an abundance of it, too much of it, it can create a restriction. It can create an imbalance as well as pain from this pulling in a different direction. So that's an overview of fascia. It's a big topic. Here is my range of motion journey. Looking pretty miserable there on 8/12. And then by 8/28, I believe this is, I've been breaking up scar tissue, and I've got some range of motion going on there. And I did have full range of motion first, so I think that's important to know. And, you know, I'm trying there. There's a little pain. I could see it in my face in this particular video. And then we skip forward to 3 months. So I'm 13 or 14 weeks, so this isn't that long ago. And I think you can't really tell, which is my surgical arm in this video. So that's, yay, I worked hard on this. I do still have pain, and I was having trouble sleeping. It's getting better. Yes, you know, that's a great thing. And I did the backstroke on that one. So what do we need the scar tissue for, and why is it such a big deal? So it's particularly in shoulders, an overabundance of scar tissue is a problem. It attaches to everything. So you might see your scar and think that's lovely. It's healed, but underneath there are structures under there, tendons and ligaments and such, and it attaches to everything and anything. You could have scar tissue in your rib cage from your shoulder. So it's really important to remodel it and tell it where to go. It will listen if you do it, if you tell it. So sometimes tissues will fuse together that shouldn't be fused together, and that will be very painful. In physical therapy, we're literally ripping the scar tissue in our movements, which is what we need to do, stretching the joint and breaking those bonds of tissue so that you can regain range of motion. There are other ways to do that too. If this doesn't work out properly, it can take years, months to heal, and none of us want that. Some of the problems with scar tissue and range of motion, and why many of you suffer with reduced range of motion. That little picture shows you regenerative healing, normal scarring, and pathological scarring. The one on the bottom shows that big lump of scar tissue. Clearly, that's going to give us a problem. The scar tissue can become thick and dense and ropey, inflexible. There's no elasticity. If you've ever seen like a tendon in a chicken or something, like that ropiness, it's kind of like that. Scar tissue forms when it doesn't come together neatly, and it doesn't ever come together neatly. It will never be as normal tissue either, but we'll do the best we can. If you could picture a lot of band-aids just like haphazardly laying themselves over each other, you get an idea of what the scar tissue looks like. Muscles, tendons, and ligaments then become quite rigid, and that's not good either. We want slide and glide in the tissues. We don't want to have stiff, tight, and weak shoulders that are tired and hurt us. That's not fun. Frozen shoulder is something that I've heard a lot of people have. Frozen shoulder happens after a period of immobility, which we all went through that. The capsule, inside the capsule becomes contracted and stiffened. The scar tissue, connective tissue, is literally in there, in the head of the humerus, right in the joint. Ways to solve that would be stretching, which we all have some experience with that. Corticosteroids, numbing medications, we all know this, in some cases surgery. But there's a whole host of other ways to work with this, and that's some of this I'd like to tell you. And to the best of my knowledge, frozen shoulder will go away in time. Remember that most scar tissue is internal. Okay, it's an internal situation. So people say, "Oh, my scars look fine." The internal you can't see. We want to create the slide and glide between the structures within the shoulder joint and outside of it as well. Mobilization. This increases blood flow to the area, which is always great. That promotes healing. Increase the elasticity of the scar tissue, and of course, increase our range of motion. Things that's great to do is myofascial release. I've been doing that for myself. I do that. I really recommend that you consider it. It manages the scar tissue and the adhesions, and you can do it yourself. It gives you agency and power over your own healing. It involves using the hands to massage the skin and the underlying tissues around the scar. You have to melt in, and I'll show you how to do it. Sometimes the motions are slow and the amount of force is usually light, but the pressure can get deep. Here are some supplies that I have used. The scar tissue sheets, I think they work very well on the outer level and maybe the first layer of fascia, but not deeper. Any medical marijuana products, if it's legal in your state, go ahead and do that. Myofascial release tools and balls are very much recommended. Castor oil is a great thing to choose. It detoxifies the tissue. It penetrates deep through the layers, so this is great, and triggers the growth of new cells. It also can relieve pain and inflammation, and as we all know, inflammation is the enemy. So how do you do this self-myofascial release? Or why do you do it? To improve your range of motion. That's what we all want, right? reduce soreness. It helps with the recovery process. It helps to relax you overall. The nervous system understands this. Improves the circulation and release tension, loss, and even stress. After releasing scars here, we need to move the skin. There's cross fibering, there's friction, pin and stretch. You need to find the resistance and have no friction below the skin and no indentations. And I'll show you how to do this. I've heard some people say that their scar has an indentation and, it's just part of it. No, it doesn't have to have those little dimples there. That's not necessary. Show you how to do some myofascial release. So I'll pretend for right now that my scar is here, okay? Just to make it easier. One of these lifelines can be my scar. The first thing that you should do is get comfortable touching your scar. Okay, that's really important that you have some amount of comfort in touching your own scar. And touching your scar, you can just start with one finger and go across, or just do circles. Touching your scar is going to desensitize it and make it much easier to do some of this work. So if that feels funky to you, practice. Just gently rub the fingers across the scar and get used to feeling it. It'll probably feel numb, it'll probably feel weird, but it's so worth it. The next thing that you'll start to try to do is cross fiber. So you're going to go, I like to use one or two fingers. We'll do one finger because it's my hand. Going across the scar this way. I was gardening yesterday. Sorry, my hands are dirty. So you're going across the scar. That's the first way to get to know it. You're just getting to go across it. And you'll notice that it's kind of lumpy right in the middle of it. And that's okay. That's what we're doing here. And then you want to start to get a hold of the skin. I guess I'll have to use a different part of me to show you that. So you want to get a hold of the skin. See how that skin moves? It's pretty elastic, good elastic skin. When you have a scar, it's going to move some way, and then it won't move another way. So that's important to know as well. I do scar on here to make it easier to understand what I'm talking about. So pretend this is a scar. So you'll go across, and it won't move as easily. This is not scarred skin. Okay. This is called cross fibering. And you want to have friction. You don't want to have oil or anything. You want that friction, because when I'm moving this, I'm moving the skin away from the other structures under it. And it goes nicely because there's nothing here to move, really. There's no indentation in the skin at all. And once you do the cross fiber, cross, then you can do crisscrosses like that. You can pin and stretch it. It can come to one end of the skin and stretch it. And you can do that all different ways. What you really want to find is the resistance. Where is it? Where is it pinned down? And when you find that, you go in circles around that and start to move it around. Once you get to that level, you can mount your finger next to the scar. Now you're remodeling. The scar has within it collagen. It has all kinds of good stuff in there to help heal it. So it's like a ready-made treasure trove of healing. You just have to access that material. And know that there will be more scar tissue on this end of the scar and this end, lots, and way down in deep. So melting in is the hardest part. It takes patience. You want to get through layer 1, 2, 3, 4, 5, 6, 7. Then you'll find it. Then you call for action. So if I found a restriction, because it won't move, then I'm going to move my arm, usually in one direction. And sometimes just pin the fingers and move the arm. I'll show you on my shoulder. It might be a little bit easier for you to understand what I'm saying too. One thing is, if you're not comfortable working on your own scar, your own fascia, to find somebody that knows what they're doing. Somebody like me, somebody who is proficient in scar release. Myofascial is best, but I'm sure there's other techniques. Well, I know there are other techniques. There's Graston technique, which uses tools to do it. There's a lot of manual ways to do it. And I really think that that's part that's missing. You can do it yourself, but it's always great when somebody else does it too. Work on my own scar, one of them. Pick this one. So it looks okay, maybe a little red. There's another one there, and there's more. So first, get comfortable just running your finger gently around the scar. To me, I've been doing this for a while. And then go across, start under it, just cross fiber. Feel what you feel. Okay, I feel hard fascia under there. I know what I'm feeling for. I know that and then I'm going to pull it one way and the other and the other. Just looking for where is it stuck? I already know that this one is stuck at the top. Okay, so find well, first you would cross fiber, make little X's like crosses. And the friction is dragging the scar one way. See how the other one comes with it? Because I'll loosen these babies up. If you have one that's dimpled in, it needs work. It's pinned to the structures under it. And then when you find the resistance, that's where you want to work it. And let's say, so I said I have resistance here, so I can pull on it. But another thing I can do is keep my finger anchored and bring my arm up. And when I do that, I feel the scar tissue push against it. And I'm going to try to maneuver under it. Pin and stretch, pulling across it in every direction you can. You can use two hands, or you can have somebody do it for you too, which is really a nice way to do it. And I also have these tools, which I find, this one is a ceramic tool, don't get a metal one, where you could use this instead. I find this is helpful in getting in next to the scar. I actually like my fingers better. So then I'm going to go along the side of each of the scar. Remember, the top goes way up to here. I've actually found scar tissue way up here. So you're going to pull it up, pull it down. Okay, pull it up, pull it down. Go across every which way. You're trying to remodel it. You're trying to get it to blend in with the other tissue, not be this rigid, scar. This one's given me the most trouble. I've been able to pull scar tissue right from the glenohumeral joint, and you can melt into the joint. You can't do this until you're 2 weeks post-op. The wound is completely closed. It's good to check with your physician, like I said. They're not all trained in this, and I'm surprised. I think every single doctor and PT should be doing this, telling us to remodel the fascia, because any form of restriction is going to make it really difficult. Let's say that this was pinned, okay? How the heck am I going to move my arm if this is pinned right to my deltoid? So you don't want that, okay? You don't want that. So you also, castor oil works great. I take the castor oil and rub it on there. It's viscous, it's kind of yucky, but to detoxify the tissue, to break up this, to remodel the scar tissue is great stuff. You put the scar tissue on, then you put like an old sheet or a towel, something that will absorb it. And then you can keep it on for 2 hours, 4 hours, 24 hours. Just make sure you don't have your favorite shirt on or anything that you don't want to ruin. So a regular massage isn't going to work this way. In a regular massage, it's a feel good. It's good for your nervous system. They're going to get deep, but they're not going to know. Well, they may. And well trained, maybe they know this technique too. So it might seem brutal to you, but I can get this scar and move it all around. What's really beneficial for me is to hold on to it and then start to move my arm. And then I start to hear snap, snaps. And ooh, that's good. I can do it again. And then you can go along here. You'll feel little snap, snaps. Don't be afraid of that. That's your scar tissue breaking up. You might even penetrate to the level of the top of one of your anchors. Back off when you feel that. I'll do this. And the whole time I've pinned my scar. It's moving one way, it's moving the other way. It's moving up, it's moving, well, I hold it here, and down. So it moves pretty well compared to my other skin, not so well. So I've got a ways to go on that. You have to do it every day. You can't, if you go to physical therapy every day and they provide the service for you, wonderful. If they don't, which I don't think many places do. I asked for it and they didn't know what I was talking about. It's kind of interesting. This is the way to work with scar tissue. You don't want to get frozen shoulder. And even if you have frozen shoulder, this can get you out of it too. I would recommend a professional if you're at that level, you already have frozen shoulder. If you're really interested in learning how to do myofascial release and this didn't make enough sense to you, please get in touch with me. Private message me. Review, what did I do here? I moved the skin. I got used to touching my own skin. I cross fibered. I held onto the scar to provide friction. I used 2 fingers to pin and to stretch it. And then I pinned it and I called for movement, finding the resistance and trying to have no friction under the skin and getting rid of any indentations. Now, the scar that I have in the back, it's a little bit different. It's an open incision. It's not that much different. Now, another technique you can use of myofascial release balls, you don't really want to roll on the scar, you want to roll on the side of it. There are a couple of other things that you can do. The levator stretch, posterior stretch, which is stretching your arm across your body. So we're stretching the posterior part of the joint capsule. You can bring your hands together, go side to side. Again, some of this you may not be able to do. Trap stretch, just pulling your elbow up, and if you can massage your own trap, both sides get sore. Sit on our hand and bring your other arm up and pull towards the shoulder. These things feel great. And one of so child pose and puppy pose. The one shown here is puppy pose. I got some great stretch out of that. He doesn't have weight on his hand, on his shoulder. It's some in his hands. It's a great opening. So try that one. And if you know what child pose is, try that. And if you have any questions or you want to help finding somebody to help you with this, please let me know. It's a huge, important part of your healing. And it's just one that is so under talked about. So release that fascia, get rid of that connective tissue that you don't need, remodel it and fix it up. Best of luck to you.